Breastfeeding is a natural and rewarding process, but it can come with challenges, especially for new mothers. Avoiding common mistakes can make the experience smoother and more enjoyable for both you and your baby. Here's a step-by-step guide on classic breastfeeding mistakes new mothers must avoid. Step 1. Educate yourself before birth. 1. Attend a breastfeeding class. Gain knowledge. Take a prenatal breastfeeding class to learn about breastfeeding techniques, latching, and common challenges. This will help you feel more prepared and confident. Ask questions. Don't hesitate to ask questions during the class to clarify any doubts or concerns you might have. 2. Consult a lactation specialist. Schedule a prenatal consultation. Meet with a lactation consultant before your baby is born. They can provide personalized advice and address specific concerns. Understand your breastfeeding goals. Discuss your breastfeeding goals with the consultant so you have a clear plan in place. Step 2. Ensure proper latching from the start. 1. Avoid a shallow latch. Check baby's mouth. Make sure your baby's mouth is wide open before latching. A shallow latch can cause nipple pain and prevent your baby from getting enough milk. Aim for a deep latch. Your baby's mouth should cover not just the nipple but a good portion of the areola. This ensures a deeper latch, reducing discomfort and improving milk transfer. 2. Recognize latch issues. Early. Look for signs of a poor latch. Signs include persistent nipple pain, cracked or bleeding nipples, and your baby seeming unsatisfied after feeding. Seek help immediately. If you're struggling with latching, don't wait. Contact a lactation consultant right away for guidance. Step 3. Avoid scheduling feedings. 1. Feed on demand. Watch for hunger cues. Feed your baby when they show signs of hunger, such as rooting, sucking on their hands, or becoming fussy. Feeding on demand helps establish a good milk supply. Avoid strict schedules. Newborns may feed frequently, sometimes every 1 to 3 hours. Avoid trying to impose a strict feeding schedule, as this can affect milk production. 2. Be flexible with feeding times. Expect cluster feeding. Some babies have periods of frequent feeding, known as cluster feeding, especially during growth spurts. This is normal and helps boost milk supply. Trust your baby's needs. Each baby is different. Trust your baby to signal when they need to feed, even if it seems frequent. Step 4. Don't ignore signs of low milk supply. 1. Monitor baby's weight and diapers. Track weight gain. Regularly check your baby's weight to ensure they are gaining appropriately. A lack of weight gain could indicate low milk supply. Count wet and dirty diapers. Your baby should have 6 to 8 wet diapers and at least 3-4 dirty diapers a day. Fewer diapers could signal a problem. 2. Boost milk supply. Early. Nurse more frequently. If you suspect low milk supply, try nursing more often to stimulate production. Skin-to-skin contact can also help increase supply. Consider pumping. If necessary, use a breast pump to help increase supply. Pumping after feedings can help stimulate additional milk production. Step 5. Avoid nipple confusion. 1. Delay introducing bottles and pacifiers. Wait to introduce bottles. If possible, avoid introducing a bottle until breastfeeding is well established, typically around 4 to 6 weeks. Early introduction can lead to nipple confusion, making it harder for your baby to latch onto the breast. Use pacifiers sparingly. Pacifiers can also contribute to nipple confusion. Limit their use until breastfeeding is well established. 2. Use the right bottle nipple. Choose a slow-flow nipple. If you do need to use a bottle, opt for a slow-flow nipple that mimics the breast, encouraging your baby to suck similarly to how they would at the breast. Paced bottle feeding. Practice paced bottle feeding to control the flow of milk and prevent your baby from preferring the faster flow of a bottle. Step 6. Avoid neglecting self-care. 1. Prioritize rest and hydration. Rest when possible. Breastfeeding is demanding. Make sure to rest whenever you can, especially in the early days. Nap when your baby naps to help recharge. Stay hydrated and eat well. Drink plenty of water and maintain a balanced diet to support milk production. Dehydration and poor nutrition can impact your supply. 2. Seek emotional support. Talk about your feelings. Breastfeeding can be emotionally challenging. Share your feelings with your partner, family, or a support group to help manage stress and stay motivated. Don't hesitate to ask for help. If you're feeling overwhelmed, ask for help with household chores or baby care so you can focus on breastfeeding and self-care. Step 7. Address pain and discomfort promptly. 1. Don't ignore pain. Pain isn't normal. While some initial discomfort is common, ongoing pain isn't. It can be a sign of a poor latch, infection, or other issues. Seek help. If you experience persistent pain, contact a lactation consultant or healthcare provider to address the issue promptly. 2. Treat engorgement and sore nipples. Use cold compresses for engorgement. If your breasts become engorged, apply cold compresses between feedings to reduce swelling. Nurse frequently to relieve engorgement. Soothe sore nipples. Apply lanolin cream or nipple ointment after feeding to soothe and protect your nipples. Air drying your nipples can also help. Final tips. Be patient and persistent. Breastfeeding can take time to master. Be patient with yourself and your baby as you both learn. Reach out for support. Don't hesitate to seek help from a lactation consultant, support group, or healthcare provider if you encounter challenges. Celebrate your success. Every breastfeeding session is an achievement. Celebrate the small victories and give yourself credit for your efforts. By avoiding these common breastfeeding mistakes and following the tips provided, you can help ensure a more comfortable and successful breastfeeding experience for both you and your baby.